Hello and welcome to The Exchange. Raising happy, healthy, secure and responsible children can be challenging at the best of times, but understanding and supporting a child who's also struggling with a mental health issue adds another dimension to parents to manage and overcome.
Understanding mental illness and recognising its potential signs is critical for parents in getting the best help for their child.
There are no broken bones, cuts or bruises. It's not easy to recognise the signs of a child's mental health problems. 14% of Australian children and adolescents experience mental health problems. As parents, we need to be aware of what to look out for, recognise the symptoms, and where to go for help. So how do you recognise if your child has a mental health issue?
Joining us on the panel is child and adolescent clinical psychologist Sally Ann McCormack, who works in private practice, specialising in psychological conditions in children and teenagers.
Rebecca Randall is a Young and Well Cooperative Research Centre PhD candidate as well as a Youth Brains Trust member. Rebecca lives with a chronic mental illness and understands the challenges that it presents.
Welcome to you both. Lovely to have you here today.
Thanks for having us.
Sally Ann, we mentioned at the beginning there that 14% of children have mental illnesses. Are those diagnosed, and what would be the severity of those mental illnesses?
Well, look, that really depends. I think that 1 in 4 children have some type of mental health issue. They say 1 in 16 has depression, so this is for children and adolescents, and these numbers are concerning. Also, what we know about adult health, adult mental health, is that I think half of it, so 50% of conditions emerge before the age of 14. So child and adolescent area is really something that we need to take focus on and to think about as parents and as
and
as
what
a
do they range from? Like when we're talking about a mental health illness in that statistic, what sort of things are we talking about?
Look, it can be something like a mild depression or a mild anxiety condition. Could be a phobia, separation anxiety. There's lots of different issues. There's also other conditions such as obsessive compulsive disorder or things that are even, get worse as they get older. But generally from young, even actually some studies show that 6-month-old babies have been diagnosed with depression. So, that's really interesting because it's pre-verbal at that point in time, but certainly by the age of 14, there's other larger conditions can start to emerge.
Rebecca, I'd love to know what inspires you in your advocacy work to make mental health more aware.
So I've experienced symptoms of a mental health issue, specifically bipolar disorder, since I was 8 years old. I was formally diagnosed at 19. And as you can imagine, getting through this point to 25, I've needed a lot of help from a lot of amazing people, and I've been really grateful for that. And so advocacy is one way in which I can give back and hopefully say thanks to a lot of people that have frankly saved my life many times.
And give people a lot of hope as well, I would say, Rebecca.
Certainly.
When you say that you had symptoms of it from 8 and then you were diagnosed at 19, that's a long way to deal with something without proper help. Why did that happen?
So part of the reason is from when I was about 8 to when I was about 13 is I was experiencing symptoms but didn't really know how to articulate them, and my parents were like, well, maybe it is maybe a personality issue, but we're not really sure what's going on. And at 13 I actually wrote a few friends' suicide notes, gave them to people at school, and then the school counsellor picked them up. And so I was in the mental health system seeing clinical psychologists from when I was about 13 to 19, but bipolar disorder in particular is not generally diagnosed till a little bit later in life because they need to look at the patterns of both depression and mania, which is the clinical highs that come with bipolar disorder. And so they really needed to establish that. But from 1925, where I'm now, I've been in consistent mental health treatment and getting a lot better.
That's wonderful.
Fantastic.
Looking back now, it's your 8 years of age. Did you see things before that? Can you see things that were kind of moving toward when you started to feel different at 8, or was it mainly when you turned 8?
Mainly when I turned 8. Of course, the memories from being that young are really quite fuzzy.
Yes, true.
Certainly 8 to 13, I can certainly see an escalation of symptoms, and then teenage years were tougher than they needed to be, perhaps.
Sure.
So what are some of
Tough
those
years anyway.
symptoms that you would be looking for, Sally Ann?
Look, as Rebecca was just saying, it's really hard. We don't diagnose major conditions like that at young ages because you have to look at history, development, all these other things. And the danger of diagnosing a child at the age of 8 with any particular disorder, such as bipolar, is that we might be wrong, in which case, there's medications and different types of treatment for these conditions. And if we're wrong at that age, then we're really messing up the whole future. So we need to take our time, treat the symptoms really in that age group, and continue forward from there and sort of wait till a point in time where we can actually diagnose. So I think what you were saying is that she wasn't really left helpless. It was just the diagnosis that she wasn't really given until an older age group.
But had you have not written those suicide notes, you could, like if you hadn't have gone to that degree, you could have been struggling with very difficult symptoms. How do we avoid that? How do we catch the people that are tittering on the border, so to speak?
So I think soon after that, and possibly even prior to it, my parents were very, very keen to keep talking to me and keep checking in regularly, and not just the "how are you going, Becca," but the more in-depth, real conversations. And that was certainly life-saving. I think quite often it's easy to just, for parents, out of a range of reasons, to just sort of say, "Oh, no, we don't need you." My parents really made that concerted effort to ask me frequently how I was going and to listen.
How good is that?
Yeah, it was.
Yeah, that must have helped a lot.
Yeah, it's really important to, for parents, and that's why I think it's great that people like you and me and you guys are actually talking about mental health, because parents don't really know what to look for. In my case, one of my daughters was actually diagnosed with depression, severe depression at the age of 9. She was also potentially suicidal. She didn't actually declare suicidality, but she was showing all of the signs, which are things like, cleaning up her room, giving away all of her precious things, that sort of thing. So, and only because I was studying psychology at that time. She's now an adult and well and healthy now, thank goodness. But, it was a great concern to me as well. And luckily, I knew what to look for, and even then missed a lot of signs. So it's great that we're getting parents talking, people talking, the community talking, to let them be aware of what's going on and how to notice it in their children.
With the community talking, what are some of the signs to look out for?
I think with some mental health conditions, it's often changes in behaviour. So in children, changes in behaviour, perhaps withdrawal from the family. It might be sleep issues as well. There might be, some things that they've previously enjoyed, they're no longer enjoying. So they might, have previously loved playing drums and they're withdrawing from those activities. That said, it's kind of tough because there's normal changes in sleep patterns in the teen years and that sort of thing. So I don't want parents to listen to this and become paranoid, but I think it's really important to at least have something in the back of their heads thinking about, is this okay? As you were saying, keep talking to your children, not just about, hi, how was your day, but really talk to them, talk about using feeling words is a really important thing to do. We need to talk about our feelings, express them. It's okay if I'm feeling angry because my pen isn't working. It's expressing it and saying it, and then, working out what I'm thinking behind it too, which I refer to as automatic negative thoughts, but I'll tell you about that after.
No, and just want to second, particularly the changes in behaviour. I think we do, as teenagers, go through various patterns of behaviour, but mental illnesses are marked patterns in behaviour, and I can certainly go through my teenage years now and say, all right, that happened then, and almost diagnose myself in retrospect with certain behaviours, and it really was those changes in behaviour that made the difference.
What were one or two examples of that, if you don't mind sharing?
Yeah, so I went through, particularly one of my early manic phases, I didn't sleep really much at all. I would get very, very interested, and still do at times, in certain behaviours. I had a sports period where I wanted to row. I'm not a sporty person. So in retrospect, that was a bit strange. So it was those sorts of changes in interest and changes in sleep.
You must have been relieved, I imagine, when a diagnosis was finally made at the age of 19. How did you feel at that point?
It definitely was relief. It was really being able to, particularly because I'm now psychology trained as well, to go and look at the patterns of behaviour and go, okay, that wasn't just me having a really down day, and it wasn't the way that person reacted to me in particular, or that time I embarrassed myself. It wasn't just me being silly and an idiot. It was really something organic going on in my brain that I couldn't have helped. And that was a massive relief.
Yeah, I can imagine.
And how do you have a plan to keep yourself well?
I do. So at the moment, it varies and changes. I take quite a lot of medication, bipolar disorder, that's quite typical in. I'm really dedicated to my studies, that makes me very, very happy. I also run and meditate. Exercise is not quite a cure-all, but it's pretty close. And meditation, I'll give a plug to Smiling Mind, which is an app that parents can use with teenagers. And frankly, it's designed for primary school kids. It is so easy to start to meditate. You do like 10 minutes a day. Anyone can do it. And that's really just helped center me and help me focus on what I need.
Smiling Mind. I'm going to download that one. That sounds really good. Just before we go to a break, Sally Ann, some of the telltale signs that parents may need to look out for to kind of nudge them toward getting some professional help.
I think listening to your children, you know, the things that they say. So, for example, the automatic negative thoughts that they have. So if they're speaking poorly about themselves, as I said, if there's changes in behaviour, you know, drastic changes in behaviour, then we need to really be aware of that. One of the things with my daughter, in retrospect, she was 3 years old, had been toilet trained, and was suddenly no longer toilet trained. That was, as it seems now, her first depressive episode. So looking for these changes that you can't explain any other way, and you know, just being in touch with your children, giving them the opportunity to talk constantly.
Yeah, constantly listening and keeping a compassionate eye out. Excellent conversation. If you'd like to know more, don't forget to head to our website. We'll be back with Street Talk and a whole lot more right after this.
What signs do you think would highlight that a child potentially has a mental health issue?
Their behaviour.
I think they wouldn't be developing at the same stage as other children. If you're in a mother's group, you'd probably be able to compare that. They'd probably be not eating or not reacting to normal things that you'd see other kids in society doing as well.
Lack of confidence, lack of socialisation.
They're not doing well at school, not sleeping well. Having behavioural issues, like maybe lots of temper tantrums, crying for no good reason.
Well, I think if they're not really engaging with their community, like friends and things like that, sleeping a lot. I mean, it's hard though with an adolescent. I mean, they generally sleep a lot. I think it's really sort of engagement and the not wanting to do the things that they usually love.
I suppose it would be behavioural. So, you know, watch out for things that are out of the ordinary. I think another thing that would be quite important is that it would be up to the maternal and child health nurse potentially, or the GP, to indicate if there are any problems or areas for concern. Yeah.
And how do you think you would respond if it was your child?
Oh, I'd definitely go and see someone. The maternal nurse would probably be the first person I'd see.
Go and seek help. Yeah, I'd probably go to the GP, get a referral.
It's a difficult one because I see my boy changing all the time, and there's moments when he's quiet, there's moments when he's just really loud, talking to himself. Sometimes he even bangs his head in the back, but some people actually say it's all right, like he just goes like that I guess as a parent it's very difficult. I honestly cannot answer that question at the top of my head. I would like to know, it would be good, because sometimes you wonder, and especially when it's your first child. I guess if you guys are doing this because it's important, and actually honestly can't answer the question, but it would be great to know.
Welcome back to The Exchange. Sandra, some really interesting responses there.
Yeah.
What stood out to you?
Oh, look, I was quite amazed that people were able to articulate certain behaviours, like lack of sleep, the things that you've already mentioned here on the show. I felt that even though it's a topic that I don't think we talk a lot about in society, that people were at least a little bit informed.
Yeah, certainly showed some good understanding and insight, I think. Sally Ann?
I agree. I think it's great that people are talking about it. No one said, oh, it doesn't exist. So it's interesting, when I started studying psychology, that we didn't talk a lot about children and adolescents having any type of mental health issues. So that was of real concern to me, particularly when my daughter was diagnosed with depression. I didn't even think about the fact that a child could. And in hindsight, it's possible that other family members have had it too as children and adolescents. We just, we need to be talking about it a lot more. And clearly the message is getting through to some degree, at least for parents. They're still a bit concerned and worried about how to talk about it.
They're talking about going to the maternal health nurse. So that we're talking about babies, toddlers?
Yes, yeah. As I said in the research, there have been babies that have been diagnosed from 6 months of age. I've not seen that, but I've certainly, in my own experience of my daughter, the age of 3 was probably her first real episode of depression. So, it does happen at young ages, and we really need to help them.
Rebecca?
Even that awareness, though, was really, really encouraging to me, that you would be looking from that very young age, and maybe parents won't see anything and maybe they won't need to seek help from a maternal health nurse, but that they were willing to, and that so many people said they'd seek help.
And they more or less knew where to go.
Exactly, and I think, yes, we've got miles to go with education, but we always will, and it's such an encouraging sign to see that sort of response.
Sally-Ann, what are some of the causes of mental health issues, do you think?
Yeah, look, there are major changes in the household. So, for example, a divorce or a death in the family, death of a pet, grief, changing schools, changing jobs, changing situations, houses. So lots of different things where there's change. Even actually the mental health of the parents, perhaps, or siblings as well, is something also to keep in mind as well.
Notice that they talked a lot about the behaviour in the child, but they didn't talk about the circumstantial stuff going on around and about them.
And also whether it's a hereditary thing?
Yeah, there certainly are risk factors. They say parents and siblings is a high risk factor, but in fact a lot of the research says maternal side as well, but certainly parents and things that happen in utero. So for example, if a parent is using excessive alcohol or drugs or some type of virus or toxin, there's lots of different things that can actually trigger it in utero as well. And as you mentioned, stressful living situations as well, something that happens in the home is quite stressful too.
Rebecca, do you ever look back? I know you seem very encouraged by what you've just heard. Do you ever look back and wish that people knew more when you were facing all of this?
I already do, and I do currently as well. One of the challenges at times is bipolar disorder is getting more well known, but Hollywood never helps, and there's a lot of negative stereotypes around what each of these illnesses are, and you worry. I will tell people at times the name of my illness, but then I don't know what's going on in their head, and I don't know if they think I'm truly crazy or if they're going to understand. And so I will hopefully need to spend less time in the future explaining how this illness impacts my life.
Yeah, how does it impact your friendships, for example?
So any illness, well, particularly my illness with ups and downs, can change. I've got a few friends who have genuinely said to me, and lovingly said to me, we don't know which Becca we're going to get.
Right, yes.
I go in sort of 6 weeks up and down cycles, and often I can pick if I'm becoming unwell or particularly high, but I don't always, particularly if I've got other stressful life events around. And so that can be really, really challenging for my friendships.
If you can pick it, do you tell them?
Close friends, yes.
Okay, good.
Close friends, and if it's likely to impact on my relationship with them, then I will. If I think it's affecting me. I don't always. I do allow myself that level of discretion. Not everyone needs to know all my personal business. But if it is going to affect my friendship with them, I'll be open and honest.
What about employment? Is it mandatory to disclose mental illness in employment?
Not as far as I'm aware.
No, it's not. It was interesting, though, a few years ago I read a study in America, thank goodness it wasn't here. It was something like 100,000 people were surveyed, and some of the questions were, would you hire someone with bipolar disorder, schizophrenia, all those things, and the answer was overwhelmingly no. And that's quite disturbing. That was in America, just to be clear, but it was quite disturbing because when you think about it here, these conditions are common, they're well managed. So, to be fearful, and that was what they said, that was in this survey, they talked about being afraid of these people that have these conditions. It's so common that, such a large percentage of people have mental illness of some variety that for, us to be afraid of people is just ridiculous.
Would there be some roles, though, that it wouldn't be appropriate? So, for example, if you had a bad back, you wouldn't be in the construction industry. Would there be something that you would say that you would think that would just not be my kind of work, Rebecca?
Not that I've encountered thus far, and I think one of the things we're working with in the mental health sector in the moment is the recovery model, which is that we will get better and we can get better. And so to exclude myself or any other person with a mental illness from a role or a profession sort of just like that, I think would be really unfair and would really diminish both their view of themselves and our view of them as a society. I'm not sure that's a good thing to do.
Have you ever felt discriminated against?
I'm fortunate not to have. That said, I've worked and volunteered in the mental health sector for about 8 years, so I'd be quite worried if I had.
Yes, absolutely.
But yeah, not yet, and hopefully not ever.
Yeah, my clients haven't. I haven't really spoken to anyone who's had any terrible experiences with work. And thankfully here in Australia, because we do have great publicity, and we're talking a lot more about mental health, I think that there's a lot of businesses that if someone higher up in the company does know about someone's mental health concerns, that they are actually quite patient and easygoing with it. So we're very lucky here.
Excellent. We often fear what we're ignorant of, so I think knowledge and education goes a long way to make a difference. Sandra, thank you so much for popping in. To see more of Sandra and Street Talk, head to theexchangetv.com.au. Back with more after this. Welcome back. We're talking about mental illness in children, mental health issues. We do first aid courses, and that kind of prepares us for things like CPR and the like. Should we be doing mental health courses or first aid? Would that be helpful?
Mental health first aid is very much a thing, actually pioneered by some people, developed in Melbourne. There's courses all over the country. I'd highly recommend, very similar to the St John's first aid course, highly recommend people look into a course.
Where would someone find a course like that, Rebecca?
Just Google mental health first aid. There's trainers that can come to you across the country.
Oh, that is absolutely brilliant.
Yeah.
There's me just coming up with that out of my head.
And I talk about things like called ANTs, automatic negative thoughts, and find various ways for the children to stomp them out. And as you mentioned in the break, about pets as well, positive empowering thoughts too, and ways of really changing the direction of the neurons in the brain, so the neuroplasticity, using that in a positive direction to empower children and empower their thoughts.
Can you give us an example of what that would look like?
Yeah, so some people have the three, what went well. So at the end of the day, talk about 3 things that perhaps went well in your day. I actually have a pet book, which I can't really go into right now, but a pet book where you write down 3 positive things about the day. But it really rewires, because we automatically think negative thoughts. It's the way that we're wired. Let's go in the positive direction and change it for children.
And write that down with the kids.
Write it down, and then they can go over it in their own time, at night time, or any time that they're feeling a little bit down. They've got their own little pet book. They can read through it and feel a little bit more positive about their world.
Great idea.
That's wonderful. A Headspace for kids is also, and teenagers is also a great resource. Have you heard of that?
Yes, Headspace is a fantastic resource, being quite well funded by the federal government at the moment, and really worth checking out. But I guess more than anything, help is out there, particularly for young people.
And you mentioned Smiling Minds,
yes,
which
Smiling
is a great
Mind.
app. I love that.
It's fantastic for meditation. Reachout.com, when I was 13, so my parents got me to help, but I also logged on to reachout.com, saved my life. The information out there developed by young people for young people. Love it to pieces.
Fabulous. And just on that as well, what sort of advice would you be giving to children, teenagers who are facing now what you've gone through?
Reach out, seek help. Don't be afraid to try new things. It is going to hurt and it might suck, but it gets better. If nothing else, my appearance on this program, I hope, can show that it gets better. There's help out there.
Definitely, you've been
you'll get better.
A great help and an inspiration to us. We've had a friend who's just had a child diagnosed with a serious mental illness, and we are so. You've just been an inspiration to me today, so thank you so much.
Yeah, wonderful.
Thank you
you,
so
Rebecca.
much.
Thank you so much, Sally Ann. Thank you for joining us. Don't forget, we'd love to hear your thoughts and ideas on what's important to you and what you think we should be addressing on this program. Hope you can join us next time.
See you then.